Good morning. My name is David Marcus. I'm a radiation oncologist at Valley View Hospital in Glenwood Springs, Colorado. I'm pleased to be here at the VisionRT Users Group meeting to talk about our center's experience with AlignRT surface guidance for SBRT using deep inspiration breath hold. As you all most likely know, SBRT was initially developed as a tool for the treatment of medically inoperable early-stage lung cancer. Subsequent to that, it has also been used for treatment of lung metastases, liver metastases, adrenal metastases, abdominal lymph node metastases, and then some other things like spinal metastases or localized prostate cancer. For purposes of this talk, however, we're going to be limiting the discussion to lung and upper abdominal tumors that we would expect would be impacted by respiratory motion. So the problem of respiratory motion is well documented, and as we know, in a normal breathing cycle, a tumor in the lung or the upper abdomen can move considerably. Here's a video to demonstrate the motion of a left upper lobe tumor that you can see right here, just sort of in a paraspinal location with respiration. And as you can see, this tumor is moving quite a bit as the patient takes a breath. And if we fail to account for such respiratory motion, we're going to run into difficulty. Particularly when we're dealing with SBRT, we need to be very careful about accounting for respiratory motion. The characteristics of SBRT, including a high dose per fraction, heterogeneous dose distributions within the planning target volume, and rapid dose fall-off outside of the planning target volume, make it absolutely critical that we target the PTV accurately. And failure to reliably address respiratory motion could result in a potentially catastrophic marginal miss, which of course is not a good outcome for a radiation treatment. Respiratory motion in this setting can be managed in a number of different ways, the first of which relies on the capture of an accurate four-dimensional CT scan, which records the tumor's position in all phases of the respiratory cycle. A 4D CT scan may be used to generate an internal target volume, or a respiratory gating approach may be used as well. There are also breath hold methods, including deep inspiration breath hold, which is primarily what we'll be discussing today, and active breathing control, which is a separate system altogether. Finally, the use of forced shallow breathing using a method such as abdominal compression may be used. The internal target volume approach is a useful method for managing respiratory motion, the primary benefit of which is that it covers the tumor in all phases of the respiratory cycle, thereby essentially eliminating the problem of respiratory motion. However, the ITV approach also relies on the accurate capture of a 4D CT and the reproducible placement of an external fiducial marker. Additionally, given that the tumor is being covered in every phase of the respiratory cycle, using an ITV approach requires a larger PTV and consequently probably a higher dose to adjacent organs at risk. On the other hand, respiratory gating allows you to treat a smaller volume than you might have to treat with an ITV approach because you're limiting your treatment to certain phases of the respiratory cycle. However, again, it relies on an accurate 4D CT capture. It relies on the fact that the patient's breathing pattern at the time of treatment accurately reproduces the breathing pattern at the time of simulation. And also, the end user does not control the beam on and beam off, and it takes a longer time to treat a patient with a respiratory gated approach than it would with an ITV approach. Deep inspiration breath hold, however, really may represent the best of both worlds, in that it eliminates respiratory motion, it does not rely on the accurate 4D CT capture, and you're able to treat with a smaller volume than is necessary for an ITV approach. In other words, deep inspiration breath hold really takes the benefits of ITV, in other words, it eliminates the problem of respiratory motion, and you get the benefits of gating, a smaller treatment volume and less dose to adjacent organs at risk, and it really combines them into the best of both possible worlds. The primary challenge of deep inspiration breath hold, however, is the question of reproducibility. In other words, how do we know that the patient is taking the same breath every time. And verifying the reproducibility of a deep inspiration breath hold is where AlignRT comes in. So I'd like to spend a few minutes talking about our center's workflow when we're using deep inspiration breath hold for SBRT using AlignRT for surface guidance. At the time of CT simulation, if we observe that a tumor is moving more than about 5 millimeters and we know that the patient is able to hold their breath for at least about 15 seconds, then we typically move on to acquire a deep inspiration breath hold CT simulation scan. And at that time, the DICOM data from that deep inspiration breath hold scan is transferred to the AlignRT system and used to create the initial AlignRT reference surface. When the patient returns for treatment, they are initially set up according to their skin tattoos. Then they are instructed to take a deep breath, and AlignRT is used to verify that the deep breath accurately reproduces the breath that they took at the time of simulation. During that breath hold, orthogonal KV images are taken, and then the patient is instructed that they can breathe normally. The necessary shifts are then calculated at the treatment console. Once those shifts are determined, the patient is then again instructed to take a deep breath. Once that deep breath has been verified to be accurate by AlignRT, the shifts are applied, and then within about a half a second or a second of application of those shifts, a new AlignRT reference surface is acquired. After we have acquired a new AlignRT reference surface and have made the appropriate shifts based on the orthogonal KV images, we will repeat the process using a cone beam CT. Again, the patient will be instructed to take a deep breath, and we will use AlignRT to verify that their deep breath is accurately reproducing the breath that they had done before. We'll then acquire the cone beam CT during that breath hold, and once that cone beam CT has been acquired, we will again instruct the patient that they can breathe normally. We will then calculate the necessary shifts, and we will then instruct the patient again to take a deep breath, verify that it's accurate with AlignRT. Once we've verified that it's accurate, we apply the shifts and then immediately capture a new AlignRT reference surface. Finally, once we're satisfied that we are in the exact correct position for treatment and we have a new reference surface based on the shifts that we have applied, we then move on to the treatment phase. We ask the patient to take a deep breath, we verify the accuracy of that breath with AlignRT, and then we initiate treatment. And throughout the course of the treatment, while the beam is on, we are monitoring the AlignRT display to make sure that the patient's surface anatomy is not going outside of our previously specified margin for error. So here's an example of a treatment that we did here at Valley View, and this is the actual treatment component. We've already gone through the shifts using both the orthogonal KV imaging and the cone beam CT imaging.
Whenever you're ready, take a breath in and hold your breath. You can breathe.
As you can see from that video, using AlignRT gives us the ability to accurately monitor the patient's surface anatomy to make sure that during the course of the radiation treatment for SBRT that the breath hold is accurately reproduced. We have really found in our clinic that deep inspiration breath hold is a useful method for mitigating respiratory motion for SBRT to lung and upper abdominal tumors that may be impacted by respiratory motion. AlignRT, for its part, facilitates a reproducible deep inspiration breath hold for SBRT, and it is easily incorporated into our SBRT workflow. I'd be happy to take any questions, and I've listed my email address here as well if you come up with any questions after the session is concluded. Thank you.